Children's Assessment Unit. Monkey sits on a bed in a ward with a tall lady, a boy and 2 girls at his bedside.
If you need some treatment, you may go into a children's assessment unit where you'll meet somebody like Mel, who's a consultant paediatrician.
What does a paediatrician do?
I'm a children's doctor. That means I look after children from when they're first born to when they're young adults, so usually when they're 16, occasionally when they're 18 years old.
Monkey's come to hospital because he's feeling poorly. What all happened to him?
Monkey will come up to the children's assessment unit and he'll be seen by a nurse who will take some observations, so they'll measure his heart rate and his temperature and his oxygen saturations and see how unwell we think he is. And then he'll see a team of doctors and nurses who will take a history and ask mum and dad some questions about what's been happening with Monkey, and they'll have a look at Monkey and decide if he needs to have some special tests and any treatment done.
How many years has it taken you to become a proper paediatrician?
My goodness me, let me work that out. Well, it takes 5 years to train to be a doctor, and then it takes probably about another 10 years to become a consultant. But you're working as a doctor all the way through that.
So it takes 15 years?
Yes. But that's important because we need to see lots of children and get lots of experience to make sure that we know what we're doing when you're unwell.
What's the most common illness you see in children in the hospital?
The most common one probably is problems with the breathing, so things like asthma. Do you know any? Put your hands up if you know anyone who's got asthma. Yes, it's quite common, isn't it? Other problems we see are children with fevers, tummy aches or vomiting and diarrhoea. Okay, monkeys, shall we have a look at you? We're going to have a listen to Monkey's chest now.
Mel puts 2 thin ends of a stethoscope into her ears and gently rests the round end on Monkey's chest. He sits, wearing an oxygen mask over his mouth and nose.
Monkey's a little bit wheezy. I think he's going to need some inhaler. Can we give Monkey some inhaler, please?
Yeah. Mel, would you like a spacer to help Monkey with
Oh,
his
yes, please,
medicine?
thank you.
A nurse puts an inhaler on a tube over Monkey's nose.
There you go, Monkey. Well done.
Monkey might need to have some more tests. He might need to have an x-ray of his chest and have some blood tests. Okay. I think we'll have him back to you very quickly now, and we'll be able to let him go home.
Thank you for letting us interview you.
That's a pleasure, Beth.
A brightly coloured playroom is full of games and toys. A little boy shares a toy train with Monkey. Monkey and the paediatrician stand by a box on the wall.
It's really important, Monkey, that we keep our hands clean. At home we wash them with soap and water. Sometimes in hospital we use a special gel like this one.
Mel pushes a flat handle on the front of the box and holds her other hand underneath to catch the gel. ITFC audio description.